There are a few important steps to take prior to the day of surgery. For instance, we'll have you obtain medical clearance, including preoperative blood work and maybe some other studies like an X-ray or an EKG, and we'll work with your primary care provider to obtain those. In addition, we recommend going to a joint class that's an educational class that gives you more in-depth exposure about what to expect after the surgery. We'll have you meet back with me in the office here probably 1 or 2 weeks before the surgery in order to review your preoperative labs and blood work, as well as to go over any other questions that have come up in the meantime. Hip replacement can either be performed at a hospital setting or more and more we're doing in the outpatient setting, and that's based on a patient-by-patient basis. Some people are candidates for that and others are not. But even if it's performed in the hospital, most people leave after 1 night in the hospital, and we'd actually have you start working with physical therapy the day of surgery, anticipating that your weight bearing is tolerated, meaning you can put as much weight down on that surgical side as you feel comfortable, but I would still expect you to be using like a walker at first for backup stability. Things to prepare for your surgery include making sure that you bring a pair of clothes to the hospital with you so you can change into those comfortable clothes when you're ready to go home. You'll also will need somebody to drive you home and somebody at the home too to help with meals and help take care of household things for at least a few days. Oftentimes after you go home the day after surgery, then we'll have a home health nurse and a home physical therapist come to your house a couple times a week and work with you there. So on the day of surgery, you'll present to either the hospital or the surgery center, and then one of the staff members will bring you back to the preoperative area. I'll meet with you in the preoperative area to review the surgical plan and answer any questions that have come up. The anesthesia doctor will meet with you as well to discuss the types of anesthesia. There are 2 main types. One is spinal and the other is general. Typically, we do a spinal anesthesia for hip replacement surgery, although a general anesthesia is totally fine as well. So we recommend starting physical therapy really as soon as we can after the surgery to get you up and moving, get those muscles around the hip firing. And we'll have you work not only with a physical therapist, but also an occupational therapist. And the role of the occupational therapist is more how to do day-to-day functions like getting in and out of a car or navigating stairs. A hip replacement does carry some risks with it. There are general risks that can be associated with any surgery, including the risk of infection, nerve injury, blood clots, or anesthesia-related complications. In addition, some risks that are specific to a hip replacement surgery include the risk of the surgical hip dislocating in the future, or having a slight leg length inequality where one leg feels slightly longer than the other. The other thing is you can get some thigh numbness around the anterior front or front side of the thigh. The risk of a major complication such as a deep wound infection or a surgical hip dislocation after hip replacement surgery is probably about 1%. So after the surgery, I recommend being on a blood thinner. Typically, I'll recommend doing aspirin for 6 weeks, but if somebody has a pre-existing blood disorder, we may need to use something that's more aggressive than that. In addition, I'll have my surgical nurse talk to you about the research study, and I ask all my patients who are having a hip replacement enroll in this study. And that requires de-identified data, so it's not directly tied to your name, but has you do a survey to describe your symptoms once before the surgery and then a few at different time points after the surgery, extending out to 2 years. All these details will be reviewed with you as you meet with my surgical nurse next. We also have a patient booklet to give you that has all these details written down.